So in Bridgend Community Services, we were looking for a technology that would be able to support people. So we have lots of people that are struggling to take the medicines as prescribed. So that may be that they're taking them incorrectly or they're not taking them at all. And so it was really looking for a way of finding a digital product that would be able to support these people. We've currently got lots of analog systems that can support these people, but we've got no way of understanding when that product is no longer working for that person. So we worked in collaboration with Life Science Hub Wales and looking at a product that would be able to support these people. So it was a product that would be able to remotely monitor, that it would organise their medication into dosage regimes and then prompt them as well to take their medicines, whilst also linking in with family members to give them an idea of whether their loved ones were taking their medicines correctly or whether they just needed a bit of a prompt, maybe from a phone call or a text message, just to take their medicines on time. So we had the product ready, and it was a case of looking at funding and value-based healthcare within Cyntaf Morgannwg University Health Board were really pivotal in being able to direct us and pointing us in the right direction of which teams we needed to engage within the health board, and securing funding then. So we're now at a point where we're able to use that funding to run a pilot in the Bridgend County. And it's really about the service user and supporting them to remain independent in their own homes as well. So we've got people that have been struggling for a number of months by the looks of it, from what we've seen when we've gone out to see these people, and they haven't been taking the medicines and they've been prescribed extra medication because they weren't originally taking the other medication they were on. So this device has really supported that person. We've been able to get rid of some of their meds that they no longer need, and they're actually taking the medicines on time every day. And we're seeing benefits from a health and wellbeing perspective as well. So as part of the benefits realization and looking at benefits from this, it's key that we really look at how the service user feels about the device. Do they see a benefit? But not only the service user, but also their family members or their unpaid carers. It's a reassurance to them, and these are the reports we're getting from people that their loved ones are taking their medicines correctly, and if they haven't, then services are able to go in and support them when they need that. So that really that remote monitoring aspect really supports us as a provider to just monitor those people that have got the real need. So if someone has a current UTI, they've got a bit of confusion, or they've had a change in their cognitive ability and struggling to take the medicines on time or correctly, then we're able to give them that extra helping hand. So as it stands, we're in the pilot that we've got, 15% of those people we're able to identify that need a bit more support, and we're able to give that extra support to get them to a point where they are adherent with their medicines, and ultimately lead into better health outcomes for that individual. So we're able to really pinpoint those people that need help, they need the extra help, and the people that don't need help and can carry on, and we can comfortably say that they're managing well in the community. So it's really being able to kind of divert resources to where we really need it and when we need it there. So the new model's working really well. It's working. People that in the community that are using it really like using it. They're really on board with using technology, and I think that can sometimes be a misconception that people don't want to use digital, but actually we're seeing that, they can do a lot more than possibly people think that they can. And as a provider, we're being able to use our resources much more efficiently. And I think that the end goal then is to really share the learning that we've had from this pilot and this project with other health boards, in the hope that they will take this forward and we can potentially spread to other health boards, not just our own.